Hello, class. So last week we talked about bones of the neurocranium. Today we will be talking about bones from the visceral cranium, or our facial bones, of which there are 14, many of which are paired. So bones of the skull are removable except for the mandible. So the facial bones include a paired set of maxillary bones, the mandibular bone or mandible, the vollmer, the palatine bones, which are paired, the inferior nasal Konkey, which is paired, the nasal bones paired, the zygomatic bone or zygoma, which is paired, and the lacrimal bone, which is also paired. So the mnemonic for this could be, many men venture past igloos near Zygoma Lake. So it's up to you if you want to use that one or come up with another one. Maybe if you come up with another one, you can let me know, and I can use it. So let's start off seeing if we can't identify, or we can identify, bones, the facial bones, from the anterior view of the skull. So the paired lacrimal bones are located, I'm going to use my little cursor right here, in blue on either side. The palatine bones from the frontal view, you can see a very small portion of the orbit here is formed by the palatine bone, and that's the deepest part of the orbit. The zygoma is noted right here in baby blue on each side. The maxillary bone, again paired, is formed right here. Their suture is right here. We'll talk about the landmarks. And so the maxilla, maxillary bones, are depicted in green. The nasal bones are up here in gray. The mandible is a darker blue right down here. The inferior nasal concha is in purple right in here within the piriform aperture, which is that opening where our nose is. The vollmer is right here in green. So the vollmer here and the ethmoid up here, the ethmoid being a cranial bone, not a facial bone, but together they form our nasal septum. So those are the bones we can see from the frontal view. So let's take a look at the lateral view of the skull. So in gray, again, is our nasal bone. The lacrimal bone is right here, and it's white. Behind it, you can see is colored as the ethmoid bone, but again, that is a cranial bone. So the lacrimal bone, you can see the little duct here, so that's kind of how you start to identify or orient yourself on the lateral view. The maxillary bone here is green. The mandible is a deep blue. The zygoma, it's a lighter blue right here. So now we're looking at the inferior view of the skull, foramen magnum towards you. So here is the maxilla in light green. This is the median palatine suture. We'll talk about that when we talk about landmarks. Kind of divides the palate, the maxillary palate, in half here. The zygoma, or zygomatic bones, are in light blue, making up a portion of our cheekbone here. The palatine bones, right here, just posterior to the maxilla. It's kind of the gateway between the maxilla and the sphenoid bone. So this brown is the sphenoid, and the green is the vollmer. So the vollmer is located kind of smack dab from the inferior aspect of the skull, right in the middle here, of the sphenoid. And then the internal view of the cranium, we don't see any facial bones at all. We just see our cranial bones. So let's look at some landmarks. So here is a frontal view of the maxilla. One of the landmarks is the canine eminence. So it's a prominence of bone over the root of the canine. So if you take your finger and you feel your canine or your eye tooth and you kind of sweep up towards, like right on the gingival tissue, you'll actually feel like this bony ridge, and that is the canine eminence. That's like sort of a protrusion of bone. Really sticks out if you run your finger over it. The canine fossa, just like an eminence, you can almost envision it's coming forward. A fossa is sort of a groove or a deepening or a trough, and that's a small depression lateral to the root of the canine. And so when we talk about going lateral, we're talking about going away from the midpoint. So it would be between the canine and the first premolar. The infraorbital foramen, located right here, this tiny little hole is an area where the infraorbital nerve, artery, and vein exit the skull. And the intermaxillary suture. So this joins, there's a suture line that runs right here, and it joins the anterior surfaces of the right and left maxillary bones. And then the maxillary sinus. So like we spoke about last week, the maxillary sinus has multiple roles. It makes our air that we breathe in warm and wet. It also lightens the weight of our skull and provides resonance to our voice. So the maxillary sinus is probably the most important sinus for dental hygienists, and we'll take a look why in a moment. So here's a frontal view of the maxillary sinus, and remember, the sinus is within the bone. It's not behind the bone, it's within the bone. So the bone is hollow. So here we can see it a little bit, but let's take a look at a lateral x-ray. Now that's a nice picture of the maxillary sinus. So what's the big deal for dentistry with the maxillary sinus? Well, you can see how close the sinus is to the roots of the maxillary teeth. Sometimes someone has a sinus infection here and they can get tooth pain, right? Sometimes tooth pain is identified wrongly as a sinus infection. So usually what happens if they have a sinus infection, they'll have kind of a throbbing on both sides. They'll say both of their molars, their top molars are throbbing, which indicates more of a sinus. If they're having pain on only one side, probably is tooth related, not sinus related. The other kind of funky thing with a sinus is if someone is missing these teeth and they need to have an implant placed, sometimes actually here, the sinus bone right down here at the floor has to be lifted, or else when you put the implant in, it can perforate right through that thin layer of bone into the sinus. So there are procedures that dentists that place implants may have to do, oral surgeons, to actually move the sinus bone a little bit. So now this is an inferior view, again, foramen magnum towards you, that we're seeing here in purple, the different landmarks from the inferior view. So we can see the incisive foramen, which is located right posterior, this little hole, posterior to 8 and 9. So if you think that those are your incisor teeth, right, central incisors, the incisive kind of sounds close. The incisive foramen is located there and is covered by a flap of tissue called the incisive papillae. Now, unfortunately, the nerve that exits out of that foramen is not the incisive nerve, but the nasopalatine nerve. So that's a little opposite of what you might think. Then we also have the median palatine suture. I'm just going to make this a little bit bigger. I'm talking. So we have the median palatine suture going this way, and then we have the transverse palatine suture going this way, separating the maxillary bones here from the palatine bones, and the median palatine suture is separating the two maxillary bones from each other. Let me shrink this up now. Now this is a lateral view of the mandible. So it's a side view. So within the side view of the mandible, we can see a lateral of the lateral view, but then we also have a medial. So the lateral view of the lateral part of the mandible is the outside, and then we also have a medial aspect of the mandible, which is the inside. And if you need to come and take a look at the mandible or the skull, just let me know so we can look at it together. So some of the landmarks. So let's talk a little bit about the mandible. So the mandible, or the lower jaw, is a single bone that is the only freely movable bone of the skull. It is the largest and strongest facial bone. The mandible has a movable articulation with the temporal bone at each temporomandibular joint. So the body of the mandible is this area going right here. The horizontal portion is the body of the mandible. The ramus is this vertical section here. And then the angle is kind of where the ramus and the body join. And it's right here. If you take your finger, you can feel the angle of the mandible. If you sweep your finger sort of inferior to your earlobe, you can feel the angle of the mandible. I want you to take a little note here of this mental foramen, this little hole. It's an area with a mental nerve, with the inferior alveolar nerve, which becomes then the mental incisive nerve, exits. And then we have the alveolar process. So this is the bony filling in between the teeth. So it's the bone that supports the teeth. The mental protuberance, so think of the chin, and it's the bony prominence of the chin that's located beneath the roots of the mandibular incisors. And this mental protuberance is usually more pronounced in males. The symphysis is at the midline. It's the midline where the mandible, when someone is very, very young, the right and left components of the mandible, it's located right here, right at the midline, fused together in early childhood. The external oblique ridge is right up here. This is our external oblique ridge. It's a crest where the ramus joins the body of the mandible, and it's a radiographic landmark. And lastly, the retromolar triangle, and that is right here. So the retromolar triangle is located just posterior to the most distal, last tooth, last molar of the mandibular dentition. So this bony landmark is covered with soft tissue in the retromolar pad of the patient. Oh, so we already talked about the mental foramen, so here it is again, this tiny opening, this hole located just inferior, usually to the second premolars. The mandibular notch is a notch located, let's go up and do these first. So here is the condyle, right? This depression here is the mandibular notch, and then this is the coronoid process. Last, there's another notch located right here called the coronoid notch. You can see it here and here. So let me go through what each one of these is. So the condyle, right here, is a projection of bone from the ramus of the mandible that participates in the TMJ. It allows the jaw to rotate and open. The mandibular notch is here. So it's just the notch that's located between the condyle, this projection, and the coronoid process. So the coronoid process here is an anterior superior projection of the ramus of the mandible. The temporalis muscle, is the muscle of mastication, inserts on the coronoid process. So this acts as a muscle attachment. And then finally the coronoid notch here and here. It's the greatest depression on the anterior border of the ramus. It's a landmark for local anesthesia for an inferior alveolar nerve block. So here is the lateral aspect of the mandible, and you can see here the medial aspect of the mandible. So the lateral goes all the way around the outside, and the medial is all the way around on the inside. So even though this is a lateral view, we also want to be aware that there are lateral aspects and medial aspects. So let me point out the coronoid notch. It's right here, here, and here. And that's that landmark for local anesthesia. Here's the lingula. It's on the medial aspect, the inner aspect of the mandible, and it's a bony spine. It's a little protrusion. It sticks out, and it kind of overhangs. It kind of forms a little roof over the mandibular foramen here. So this serves, the lingula serves as an attachment for the sphenomandibular ligament associated with the TMJ. The submandibular fossa, right down here. Now this is where our submandibular salivary gland sits. Our mandibular canal starts, so in the mandibular foramen, here's a hole. Inside, there's a canal where blood vessels and the inferior alveolar nerve travel. Perfect. So here's our condyle, our mandibular notch. This is coracoid process. It should say coronoid process, so the picture is wrong. Another bump, and then we come down, and here's our coronoid notch down here. So this is the mandibular notch, and this is the coronoid notch here. So this here is the landmark for local anesthesia. And here's a good view of that mental foramen, these little tiny holes that up here is the mandibular foramen, and here is the mental foramen. These are areas where blood vessels, nerves, and veins travel in and out of the bone. Frontal view of the nasal bones, here in purple. So that forms the bridge of our nose and supports cartilage of our nose. And it can often be fractured by a blow to the nose. So if you get a punch in the face and you break your nose, these are the portion of your nose bones that are broken here. So the inferior nasal conky, here's the frontal view. You know, I'm going to blow this up a little bit so I can point them out. Where are they? Here they are, these two little green projections. So these are separate bones. Do you remember last week we talked about the middle nasal conky and the superior nasal conky? Can't really see the superior nasal conky. They're located here in this image, but usually from a frontal view, the nasal bones will cover the superior nasal conky. But the superior and middle nasal conky are projections off the ethmoid bone. The inferior nasal conky is located right down here. All right? And those help to sort of get the air that we breathe in swirling because of their scroll-like formation. Shaped like a scroll. Yeah, they're shaped like a scroll. So it makes the air swirl, which helps with warming the air. So deep to each conky, superior, middle, and inferior, is a groove, the nasal meatus. And each has an opening through which the paranasal sinuses, frontal, ethmoid, sphenoid, maxillary, or the nasolacrimal duct communicates with the nasal cavity. So that's why kind of like the nose and the eyes all kind of can drain. You get that postnasal drip and things like that. So here is a frontal view of the vomer, which has no muscle attachments. Again, I'm going to get this, I'm going to come out here so we can get a good look of the vomer right in here. So even though this says inferior nasal Konkey, which it shows right here on either side, I liked this image enough that I wanted to show the vomer here, and then the other bone that forms the nasal septum is the ethmoid bone. And here is a lateral view, the wall of the nasal cavity. And it's all labeled, so you can take some time here. Let me see if I can't shrink that up a little bit so you can see it, to go over each one, which each one is located. So let me see, frontal bone. Oh, look at this. This is a nice view here of the sinus. Do you see how the bone is hollow? So that's pretty cool. And the nasal bone projecting out this way. All right, so take some time. You might be able to blow this up to look through and orient yourself that this is basically a cutting of the person into left and right halves. All right, so it's a sagittal section. Palatine bones kind of makes you think of the palate, right? But if you look here, a lot of the palate's actually formed by the maxilla. So the maxilla forms the anterior portion and the palatine bones form the posterior portion. So the palatine bones consist of two plates, one moving horizontally and one vertically. So it serves as kind of a link or a junction between the maxilla and the sphenoid bone. The greater palatine foramen and the lesser palatine foramen, which transmit nerves and blood vessels to the region. So it's important for us because we actually anesthetize greater palatine nerves during local anesthesia. So let me see if I can't make this a little bit bigger and see if we can't really take a look at those foramens. So here's the greater palatine foramen. We don't really get the lesser palatine foramen, the nerve that exits out of that, because that kind of makes the back of the throat numb, and that's usually not what we need to do as hygienists. Okay. And the zygomatic bones, or the zygoma, so that forms the cheekbones, which is also known as the malar surfaces. It articulates with the frontal, temporal, sphenoid, and maxillary bones, and it's composed of three processes. So we spoke a little bit last week about how as one bone approaches another bone, it's called its process. So as the zygoma approaches the frontal bone, that's then now known as the frontal process of the zygoma. As the zygoma attaches with the temporal bone, that's now considered the temporal process of the zygoma. And then as the zygoma approaches the maxilla, that becomes known as the maxillary process of the zygoma. So this image is taken right out of your textbook. So let's look here. The frontal process of the zygoma here forms the anterior lateral orbital wall. So if we orient ourselves, this is the nose, so this would be considered the medial aspect of the eye socket, or the wall that's closest to the nose. So the frontal process of the zygoma forms the outside or lateral orbital wall. The temporal process forms the zygomatic arch together with the zygomatic process of the temporal bone. So right here is the temporal process of the zygoma. Okay. The maxillary process forms a portion of the infraorbital rim. So that's below the eye. So it's kind of like your lower rim. If you take your finger and kind of direct it below your eyelashes, you can feel the rim of your eye socket. So the maxillary process forms right here, a portion of the infraorbital rim, and a small portion of the lateral orbital wall. And the lacrimal bones. So they form a small portion of the anterior medial wall of the orbit. So that's the wall kind of closest to the nose. The nasolacrimal duct is formed at the junction of the lacrimal bone and the maxilla, and tears are drained through this duct. So normally tears, your eyes are tearing all the time. It's good for your eyes to be wet. You have oil glands that keep the water against your eye. You want your eyes to be wet, and they are drained through this duct into the inferior nasal meatus. Meatus just means hole or opening. Now, when we cry, we can't drain fast enough, and that's when tears start spilling outside of our eye. So let's review, or this is for you to review. So these are all, and I'll put this up so that you can kind of spread it out if you want and make it really large, just like this. All right, all of these are labeled, so the expectation is you will be able to tell me where the frontal bone is, where the nasal bone, the lacrimal bone. So they're all labeled with numbers. We're going a little bit in reverse here, but let's talk about the orbit. So the orbit, we spoke a little bit about last week, is formed by multiple bones. It's formed by 3 cranial bones, the ethmoid, sphenoid, and frontal, and it's also composed of 4 facial bones, the zygoma, the maxillae, the lacrimal, and the palatine. But a very, very small portion of the palatine seen at the apex of the orbit. So that means way deep. So let's look at the picture here. So most of the roof, right, we can think of the roof as being the top, is formed by the frontal bone. And most of the floor is formed by the maxilla. The anterior lateral wall is formed by the orbital process of the zygoma. So what does that mean? That means here, the lateral. So let's orient ourselves. This is the nasal bone, right? So this is the nose, and this is coming outward more lateral. So here is the zygoma. The posterior lateral wall is formed by the greater wing of the sphenoid. So here's the sphenoid bone. The lesser wing of the sphenoid and the palatine bone form the deepest portion of the orbit. So here is the palatine bone. And let's look. And up here is the lesser wing of the sphenoid. All right, so did we get them all? Let's see. So here's the lacrimal bone, the ethmoid bone, forming the medial surfaces, greater wing of the sphenoid, it kind of looks greater, lesser wing of the sphenoid, frontal bone, zygoma, maxilla, all form a portion of our eye orbit. So here's a mid-sagittal section, again labeled for you. Here is a labeled section of our mandible. You have to have the PowerPoint open because it's labeled underneath. Here's the condyle, here's the neck of the condyle, this is the mandibular notch, here's the coronoid process, here's the coronoid notch here. So you can take some time and go over these landmarks, and they're all noted at the bottom. So this is a lateral view, lateral aspect. Now let's look, here's the medial view. Here's our mandibular foramen. 16 would be that bony covering known as the lingula. So they're all labeled underneath. So kind of shrink up the PowerPoint image and you'll be able to see words underneath. You'll also be able to see just about everything I've said underneath. If you want to follow along, it's in writing.